Hi, this is Jessica DaMassa, and I'm here at Health Datapalooza. I'm here with Timmeko Love, and she is from Mayo Clinic Business Development. Hi.
Good morning.
Good morning. So talk to me about what you guys at Mayo Clinic are looking at from an investment standpoint lately. I know you have a lot of innovation that comes from inside the organization, so are you looking in? Are you looking out? What are you guys focused on?
And I would say a bit of both. We do certainly a good amount of innovation at Mayo Clinic, a lot of intellectual property developed there. So we're looking to get those technologies out into the marketplace, but we're also collaborating with a number of startup companies in the marketplace. So I would say it's a two-flow collaboration.
All right, so when you guys look outside, because you've got all of this genius on the inside, when you look out, what are you guys looking for?
We're looking at things that really align with our core value. The needs of the patient come first. So really driving patient empowerment, patient outcomes, really improving that provider and patient interaction. Those are the things that register high with Mayo Clinic.
Okay. And as like a big health system and as a research institution, you guys, and you're famous for innovation. So like, what can we learn? Like, give us some tips on like how to be innovative within healthcare.
Just understanding that it comes from all facets of the organization. So not just our clinicians and researchers, but our allied health staff, our nursing staff, lots of innovative ideas and really fostering a culture that allows those to happen. Being okay with failure, learning from failure, but then also harnessing the power of innovation.
All right. We have a lot of startups that watch us, and I always ask for them. It's for some good advice. So if a startup wants to work with a big health system like a Mayo Clinic, what's your advice for them? How do they even, get started? And like, what kinds of things, I guess, are attractive in terms of solutions?
So I would say, first of all, know who the decision makers are.
But that's easier said than done. So how do you find that out?
So Mayo Clinic is an enterprise organization. We do have consolidated supply chain management, and a lot of those resources get to know those folks in those areas, but as well as the clinical staff and those decision makers, administrators, the specialty chairman of the departments. Those are the key decision makers in a place like Mayo, an academic medical center. And so knowing how to navigate those pathways, and then business development. Not every provider system has a business development arm, but when you find one that does, it really can be a pathway into all of those different forums and organizations.
Okay, because not every organization has a business development arm, tell me a little bit about what sets that kind of department or that kind of mindset or approach that you guys take in business development apart.
Well, I would say for us, it really is that idea around collaboration and teamwork. And so we want to co-create with our vendor partners, with our with the startup ecosystem, and with our patients for that matter. So for us, it really is that openness and willingness to say, let's pick this apart together to optimize it to deliver better patient care.
Is there anything that you guys have invested in lately that you're excited about, that you want to talk about?
So we actually like the idea of the AI space, but we call it augmented human intelligence.
Okay.
The idea of...
I love that you've rebranded it, augmented human intelligence.
That's right. And so the idea that we can really improve decision-making for providers, provide more information that will enable us to make improved and faster clinical decisions. So that's a space we're following and actually investing in.
Very cool. I was going to ask you too, so we're WTF Health, so what's the future? So, looking down the road, you're very excited about AI. Is there anything else? What do you think, I guess, is like in terms of, from your mindset, coming from a business development perspective, at Mayo, what's the future? What do you think is next?
So we're all about actually implementing telemedicine as well.
Okay.
So the care at home and keeping in contact with our patient post-discharge.
Okay.
We are a destination medical center, so people fly from all over to come to Mayo Clinic, but when they leave, we want to continue that conversation. We want to make sure that they're adhering to medication and staying in line with their care plan. So technologies that really enable that, for us to be in contact at a distance, we're all about those types of solutions.
All right, very cool. Well, thank you so much for talking with me. It's a
Thank
pleasure
you.
to speak with you. We'll talk to you again soon, I hope. I'm Jessica DaMassa here at Health Datapalooza for WTF Health.